If you're over 60, here's a question most people never think to ask, but should. What if the position you sleep in tonight could raise stroke risk, reduce oxygen to your brain, strain your heart, or quietly reshape your spine over the next few years? New data from the National Institute on Aging shows that the wrong sleep position can reduce oxygen by 10 to 20%, compress major blood vessels, overstretch cervical nerves, and increase nighttime sympathetic activation, the exact pattern that makes older adults wake up tired, stiff, dizzy, or breathless even after a full night in bed. And here's the part most seniors completely overlook. 7 in 10 adults over 60 don't have a sleep time problem. They have a sleep position problem. They're not waking up because their body can't sleep. They're waking up because their body is fighting the position it's forced to sleep in. Neck pain, morning headaches, numb hands, shallow breathing, midnight heart flutters. These aren't random signs of aging. They're mechanical consequences of the angles, twists, compressions, and blockages created by the way you lie down. And the surprising truth is this: fixing your sleep may not require more hours, more supplements, or more effort, just a different position. I'm Dr. Jonathan Reed, a physician specializing in sleep and aging physiology for more than 25 years, and today I'll show you the 4 worst sleep positions silently harming older adults every night, and the 4 positions that restore oxygen, reduce spinal strain, calm the nervous system, and help you wake up clearer, lighter, and younger. Before we start, tap like so more seniors can see this, share it with someone who wakes up sore, and subscribe so you don't miss the next video in this series. And tell me in the comments which position you sleep in right now. Let's begin. Number 4, the fetal curl. The fetal curl looks harmless, comforting, familiar, almost instinctive. Many older adults slip into it without thinking, pulling the knees toward the chest and rounding the spine because it feels safe. But after 60, this position quietly works against nearly every system that keeps your sleep stable. The first problem is breathing. When you curl tightly, your ribs compress forward and your diaphragm loses space to move. For a younger adult, this just means slightly shallower breaths. But in an older body, where lung elasticity is lower and oxygen exchange is already reduced, that curl can drop nighttime oxygen by 10 to 25%. And low oxygen is one of the fastest ways to weaken the first half of the night, making sleep lighter, more fragile, and easier to break. The second problem is spinal alignment. A tight curl rounds the entire back, from the tailbone to the neck. That shape isn't neutral. It stretches some muscles while overloading others, especially in the lower spine. Seniors who sleep this way often wake with a stiff back, sore hips, or a bent forward feeling that takes hours to undo. Over years, it can even reinforce a stooped posture. Then there's the nervous system. A curled position subtly raises protective tension. The body reads the posture as defensive, not resting. That microtension increases sympathetic tone, which makes midnight awakenings more likely and deep sleep harder to reach. Eleanor, a 70-year-old retired teacher I worked with, had slept in a tight fetal curl for more than 40 years. She thought her morning breathlessness and lower back fatigue were just aging catching up. When she learned the curl was compressing her diaphragm and rounding her lumbar spine every night, she switched to a supported side position. Within a week, her breathing eased, her back loosened, and she woke noticeably more refreshed. The fetal curl feels comforting, but for seniors, it compresses, restricts, and strains. If this position makes your body fold inward, the next one does something even more damaging. It twists your spine while you sleep. Number 3, the half front twist. Some positions cause trouble the moment you get into them. Others take hours to reveal their damage, and the half front twist is one of those silent disruptors. It looks like side sleeping at first, but then the top shoulder rolls forward, the upper knee drops toward the mattress, and suddenly half your body is twisted toward your stomach while the other half stays on its side. For adults over 60, that gentle twist becomes far more than a small adjustment. The first issue is spinal rotation. When the upper body collapses forward while the hips remain angled to the side, The lower back becomes the pivot point. In older adults, where discs are thinner and spinal joints less tolerant, that rotation irritates the lumbar region through the night. Many seniors who sleep this way wake with a tight pull across one side of the lower back or a deep ache just above the hip. The second issue is nerve tension. That forward rolled shoulder subtly drags the neck out of alignment. The nerves running from the neck down the arm pass through narrow channels. A few hours of compression is enough to trigger morning tingling, numb fingers, or a throbbing soreness along one shoulder blade. People often assume it's arthritis, but it's posture. The third issue is breathing. This half-stomach angle presses one side of the rib cage, limiting how well the underlying lung can expand. Older adults naturally have reduced lung elasticity, so even mild compression can reduce nighttime oxygen, make breathing lighter, and increase microarousals. Harold, 74, had both arm numbness and a nagging hip ache he blamed on age. But the moment we corrected this twisted posture, adding a pillow to keep his top knee from falling forward and keeping the shoulder stacked instead of rolling, his symptoms eased within a week. The half-front twist feels harmless, even comfortable. But for seniors, it quietly strains the spine, irritates nerves, and restricts breathing. Three things you absolutely don't want happening for 6 or 7 hours straight. And if this posture bends and compresses your body, the next one goes even further. It allows gravity to collapse your airway itself. Number 2, the flat back soldier position. Some sleeping positions don't twist the spine or pinch a nerve. They interrupt something far more essential, your ability to breathe freely through the night. And for many adults over 60, the flat back soldier position is exactly that trap. It looks clean and harmless. Hands by your sides, legs straight, neck neutral. But the moment you fall asleep, gravity takes over. And that's where the problems begin. As the jaw and soft tissues loosen, they fall backward toward the throat. In younger adults, muscle tone keeps the airway relatively open. After 60, that tone declines, the airway narrows more easily, and even a mild collapse can reduce airflow. The result isn't dramatic choking, it's repeated microdrops in oxygen that jolt the brain into lighter sleep. Most people never remember these awakenings. They just wake up tired. The second problem is the tongue. When you lie flat, the tongue naturally slides toward the back of the throat, a position that increases snoring and raises the likelihood of brief apnea events. Seniors already experience reduced airway stability. This posture magnifies the vulnerability. Then comes reflux, the silent version most people never notice. Lying flat allows stomach acid to drift upward more easily, especially if digestion is slower or the evening meal was later than usual. That tiny upward movement doesn't always burn, but it does activate the vagus nerve, the same nerve that influences heart rate and signals the brain to wake. Robert, 74, believed he simply slept lightly. A home sleep study showed otherwise. Over 30 breathing disruptions per hour when he slept flat on his back. Once he switched to a slightly elevated position with knee support, his nighttime awakenings dropped dramatically. The soldier position isn't dangerous during the day, but at night, for older adults, it can quietly trigger airway collapse, reflux signaling, and oxygen instability. All three fragment deep sleep long before morning. And while this posture compromises your breathing, the next one strains the entire body at once, from your neck to your lungs. And it's the most damaging of all. Number 1, stomach sleeping, face down. Some positions only disturb your sleep. This one can damage the systems that keep you balanced, clear-headed, and steady through the day. Stomach sleeping looks innocent, even comforting, because many people grew up doing it. But after 60, it becomes the single most punishing position for the neck, the spine, and the airway. And most seniors never connect the dots between their morning symptoms and the way they spent the night. The first problem is the neck. To breathe while lying face down, you must rotate your head sharply to one side. And you hold that twist for 6, 7, sometimes 8 hours. In an aging spine, with thinner discs and more sensitive joints, that rotation compresses the vertebral arteries and strains the nerves that travel into the shoulders and arms. The result shows up the next morning as dizziness, headaches, tingling fingers, or a heavy feeling behind the eyes. None of it feels like a sleep position issue, but it is. The second problem is the chest and diaphragm. Face down, the weight of your torso presses into the ribs, reducing lung expansion and forcing you to breathe shallowly. Shallow breathing reduces oxygen delivery. And when oxygen dips at night, the brain pulls you out of deep sleep to protect itself. You won't wake all the way up, but you'll drift into lighter, fractured sleep that leaves your body unrefreshed. The third problem is the lower back. Stomach sleeping arches the lumbar spine unnaturally, increasing pressure on the discs and tightening the muscles that stabilize posture. Many older adults who wake with unexplained low back stiffness or hip pain discover it's not age. It's this posture quietly loading the spine hour after hour. Linda, 72, came to me convinced she had early nerve disease. She woke every morning with hand numbness, shoulder pain, and a strange buzzing sensation along her jawline. When she stopped sleeping face down, nothing else changed. Her symptoms began easing within days and were almost gone in 2 weeks. Among all sleep positions, stomach sleeping is the harshest on a senior body, restricting breathing, twisting the neck, straining the spine, and disrupting the very stages of sleep that repair the brain. Now that we've cleared the 4 most harmful positions, it's time to rebuild your sleep from the inside out with the 4 that restore alignment, breathing, and true deep rest. Number 4, elevated back sleeper, head raised, knees supported. This position is one of the simplest adjustments an older adult can make, and one of the fastest acting. Elevating the upper body and supporting the knees changes the mechanics of nighttime breathing, reflux, and spinal pressure in ways that matter enormously after 60. When you lie completely flat, gravity pulls the tongue and soft tissues backward. In younger adults, this isn't a problem, but with age, airway muscles lose tone. Even a slight collapse narrows the throat enough to trigger snoring, microarousals, or short pauses in breathing that fragment deep sleep. Raising the head and chest by 20 to 30 degrees helps keep the airway open and reduces these interruptions immediately. Many seniors describe the difference as finally breathing freely at night. This elevation also protects against one of the most overlooked sleep disruptors in older adults: nighttime reflux. When the upper body is lifted, stomach acid is far less likely to travel upward. The burning isn't always obvious. Silent reflux can simply show up as coughing, throat clearing, a racing heart, or sudden awakenings around the first sleep cycle. A gentle incline prevents this upward flow and helps the diaphragm stay relaxed instead of irritated. Supporting the knees is equally important. Placing a pillow beneath them flattens the lower back, easing pressure on the lumbar joints and reducing the early morning stiffness that so many older adults assume is normal aging. Margaret, 69, struggled for years with middle-of-the-night waking, convinced it was just part of getting older. When she switched to an elevated back setup with a wedge pillow and light knee support, she slept through the first 4 hours of the night for the first time in over a decade. This position is gentle, protective, and easy to adopt. If your breathing feels tight at night or reflux tends to break your sleep, this is the perfect place to begin. Number 3, open shoulder side rest. This position is a quiet workhorse for older adults, one that releases pressure from the shoulders, protects the neck, and improves blood flow to the upper spine and brain. It's a powerful upgrade from the curled, compressed side sleeping posture many seniors fall into without realizing the strain it creates. Most older adults sleep on their side, but they tuck the upper arm forward or collapse the shoulder inward. This folds the chest, rotates the neck, and pinches the nerves that run through the shoulder girdle. Over time, this repeated compression can create morning numbness in the hands, aching in the upper back, and a lingering tightness at the base of the skull that makes the entire night feel lighter and more fragile. The open shoulder variation corrects all of that with one simple change. Instead of rolling the top arm across the body, you open it gently at a 30 to 45 degree angle. This keeps the chest open, the shoulder joint neutral, and the nerves in the brachial plexus free from nighttime compression. The airway also benefits. With the chest less collapsed, breathing becomes deeper and more rhythmic. Neck alignment improves as well. When the shoulders are no longer hunching inward, the cervical spine can stay level with the torso. That reduces the micro-strain that leads to morning stiffness and those brief, unexplained awakenings halfway through the night. Catherine, age 69, had lived with chronic shoulder tightness for years. Even physical therapy helped only temporarily. But when she shifted to this open shoulder position, top arm relaxed outward, bottom arm supported, neck on a medium-height pillow, her morning pain dropped by half within 2 weeks. More importantly, her sleep cycles became steadier, with fewer early morning interruptions. This position is especially helpful if you wake with tingling fingers, tight shoulders, or a stiff neck. It opens space in the upper body, improves circulation, and allows the nervous system to settle instead of fighting through tension all night. If your goal is to release the upper body and protect the nerves that most commonly disrupt sleep after 60, this position is one of the strongest upgrades you can make. Number 2, the 45-degree side recline. For many older adults, this position becomes a turning point, the place where breathing steadies, reflux settles, and the heart finally relaxes enough to support deeper sleep. It is sometimes called the senior sweet spot because it targets 3 of the biggest disruptors after 60: airway collapse, nighttime acid backflow, and the subtle cardiovascular strain that makes the second half of the night so fragile. The structure is simple. Your upper body is elevated about 45 degrees, your torso gently turned to the left, and a pillow placed between your knees to keep the spine aligned. But the physiology behind it is powerful. Elevation is the first key. At a 45-degree incline, gravity works for you, not against you. Soft tissues in the throat no longer fall backward, reducing snoring, easing partial airway obstruction, and cutting the risk of apnea events. Many seniors who struggle with, "I fall asleep fine, but I wake up gasping at 2 a.m., don't have a sleep onset problem. They have a position problem. This angle alters that instantly. Turning slightly to the left is the second key. In older adults, gastric emptying is slower, and nighttime reflux becomes more common, even without heartburn. Lying flat or leaning right allows acid to travel upward toward the esophagus. Leaning left uses anatomy to your advantage. The stomach sits lower, the esophageal opening sits higher, and reflux drops dramatically. The result is fewer wake-ups triggered by chest pressure, throat irritation, or that subtle warm rush many seniors feel without knowing what it is. Spinal alignment is the third key. The knee pillow prevents the hips and lower back from twisting, which keeps the lumbar spine neutral. For seniors with morning stiffness or radiating leg discomfort, this alone can make the early night sleep cycles more stable. Walter, age 75, had spent years waking around 3 a.m., breathing slightly too hard, heart tapping a little too quickly. He assumed it was age until he switched to the 45-degree side recline. Within 10 nights, his deep sleep measurements increased by 32%, and those predictable early morning awakenings nearly disappeared. This position is ideal if you snore, deal with reflux, wake with a racing heart, or find that your sleep breaks during the second half of the night. It supports the airway, the digestive system, and the spine all at once, a rare combination that makes it one of the most effective sleep positions for adults in their 60s, 70s, and beyond. Number 1, supported side sleep with a knee pillow. For seniors in their 60s, 70s, and beyond, this is the single most effective sleeping position I've seen. The one that protects the spine, stabilizes breathing, quiets the nervous system, and keeps the body asleep through the most fragile part of the night. Supported side sleep means lying fully on your side with your neck neutral and a firm pillow placed between your knees. It sounds almost too simple, but for an aging body, small structural changes create large physiological effects. The biggest benefit is spinal alignment. Past 60, the discs thin and the hips begin to rotate more during sleep. If the top leg falls forward, which happens to almost everyone, the pelvis twists, the lumbar spine rotates, and the nerves in the lower back stay slightly activated. That activation doesn't always produce pain, but it does trigger microarousals that break sleep cycles. A knee pillow fixes this instantly. It keeps the hips stacked, prevents lumbar rotation, and lets the nervous system stay quiet instead of guarding the spine all night. The second benefit is joint unloading. When you sleep without leg support, pressure accumulates in the hips, knees, and sacrum. Pressure that becomes sharper and more sleep disruptive with age. Proper side support absorbs that tension, allowing the muscles and joints to stay relaxed through the deeper stages of sleep. Breathing also improves. Unlike face-down sleeping, which twists the neck, or flat back sleeping, which lets the airway narrow, supported side sleep keeps the throat open and reduces airway collapse. Older adults with snoring, mild apnea, or "I wake up because my breathing startles me" often see immediate improvement. One of my patients, Alan, 72, had lived with morning stiffness and unpredictable 3 a.m. awakenings for nearly a decade. We didn't change his mattress, his diet, or his supplements, only his position. After 2 weeks of committed, supported side sleeping with a knee pillow, his early morning wake-ups dropped dramatically, and his back pain lightened for the first time in years. Supported side sleep works for almost every profile I see: back pain, hip pain, reflux, snoring, apnea, light sleep, or fragmented sleep patterns. It supports the airway, protects the spine, stabilizes the nervous system, and removes the joint stress that wakes so many older adults without warning. If the four worst positions slowly exhaust your body, this is the one that restores it. Try it tonight. Most seniors feel a measurable difference within the first few nights. Your sleep doesn't decline because your body forgets how to rest. It declines because the signals and structures that once protected your nights have shifted. The positions you saw today aren't small adjustments. They're the difference between compressed airways and open ones, between stressed joints and supported ones, between a night that breaks at 2 a.m. and a night that holds. You don't need new medications. You don't need a different mattress. You just need the right alignment, the one that lets your nervous system settle, your spine release, and your breathing stay steady until morning. Try one of the better positions tonight. Commit to it for 3 nights. Most seniors are shocked by how quickly the body responds when it's finally supported instead of strained. If you found this helpful, like, share, and subscribe, and tell me in the comments, which position will you use tonight?